Good morning, and thank you for registering to the webinar on the leading health indicators. I would now like to introduce Dr. Don Wright, Deputy Assistant Secretary for Health at the Department of Health and Human Services.
Thank you very much. Next slide. Welcome to the first installment of the monthly series, Who's Leading the Leading Health Indicators? Each month, this series will highlight an organization that is using evidence-based approaches to address one of the Healthy People 2020 leading health indicator topics. Next slide. During today's webinar, you will hear from 4 distinguished speakers. Assistant Secretary for Health, Dr. Howard Koh, will introduce this month's leading health indicator topic, Access to Health Services. Health and Human Services Regional Director of Region 5, Kenneth Munson, will give a snapshot of access to health services in HHS Region 5. And finally, for this month's featured organization, Chicago's Southside Healthcare Collaborative, Kimberly Hobson and Dr. Daniel Johnson will discuss how they are increasing access to health services in their community. Next slide. First, let me give you some background on Healthy People, the initiative that introduced the leading health indicators. For 4 decades, Healthy People has provided a comprehensive set of national 10-year objectives that have served as a framework for public health activities at all levels and across the public health community. The Healthy People Initiative has evolved as the nation's public health priorities have changed. Often referred to as a roadmap for national health promotion and disease prevention efforts, Healthy People is about understanding where we are now and taking informed actions to get where we want to go over a 10-year period of time. Next slide. You may be interested, what are the leading health indicators? Well, the leading health indicators are critical health issues that, if addressed appropriately, will dramatically reduce the leading causes of preventable death and illnesses. These indicators, our critical health issues, are linked to specific Healthy People objectives. They've been selected to communicate high-priority health issues to the public, along with actions that can be taken to address them with the overall goal of improving the health of the entire population. Next slide. Well, as you can see, there are 12 LHI topics. We intend to highlight one of these topics every month in 2012. This month, the leading health indicator will be focusing on access to health services. We are showcasing the Southside Healthcare Collaborative, which has made significant advances in improving access to primary care services for residents of Chicago's South Side. At this point, I'd like to now welcome Dr. Howard Koh.
Thank you, Dr. Wright. Thank you for your leadership, and I'm absolutely delighted to be here to help launch this very exciting monthly series. Healthy People 2020 and the Leading Health Indicators offers our country a 2020 vision for a healthier nation. So we're thrilled to have so many people joining us for this launch. Allow me to give you a brief overview on this month's LHI topic, Access to Health Services. We chose this topic to lead off our series because access to health services has been one of this administration's top priorities. And we all know that to improve the health of all Americans, it's critical that more Americans have access to both routine medical care and medical insurance. Access to health services has a profound impact on every aspect of a person's health. And we understand that people without medical insurance are more likely to lack a usual source of medical care and are more likely to skip routine medical care due to costs, increasing their risk for serious and disabling health conditions. The leading health indicator, Access to Health Services, is divided into 2 parts. First, whether or not there's access to medical insurance, and secondly, whether or not people have a usual primary care provider. Unfortunately, right now in America, 1 in 4 people has no primary care provider or health center where they can receive regular medical services, and approximately 1 in 6 Americans has no medical insurance. But fortunately, our new health reform law has already begun expanding coverage to millions of Americans. And we at the Department of Health and Human Services are committed to this effort in a number of ways. For example, our Health Resources and Services Administration supports a network of more than 1,100 community health centers that provide quality care to underserved communities. Also, the health reform law is increasing access to affordable care by providing free access to many preventive services such as vaccinations and cancer screenings. And just recently, we have learned that the number of people in the 19 to 25 age bracket who are being covered by health insurance has increased by about 2.5 million compared to 2010 figures. That's because the new health care law now allows children to stay on their parents' health plan until their 26th birthday. So, thanks to this new law, we are truly making progress to reach our Healthy People 2020 Leading Health Indicator goal of increasing access to health care for all Americans. So at this point, I'd like to turn the program over to our Regional Director of Region 5, Kenneth Munson, who will add a few words.
Thank you, Dr. Coe. Well, it's a real privilege for me to be here with you all today, and I'm really proud that today's webinar also will highlight some of the great work being done here in Region 5. Region 5 is the 6 states in the upper Midwest, and this program we'll be talking about is in the Chicago area. And I'll echo Dr. Coe in saying that access to primary care is critical. Having a medical provider who knows you, who can help you manage your chronic conditions and your emerging health challenges. We know that increasing access to quality primary care saves lives, reduces suffering, and by the way, also saves money. And as Dr. Coe said, here in Region 5, we're certainly aware that the health reform law that was signed by the President in 2010 really invests in many ways in promoting and providing and expanding access to primary care. One way is the investments in the National Health Service Program, which funds the primary care workforce in underserved communities. Illinois alone here, that program is funded in 2011, about 300 new providers, doctors, nurses, and others, who will be providing primary care in the most underserved areas in this state, and that's taking place across the whole country. And also that the health reform law invests, as Dr. Coe said, in new and expanded community health centers. Here in our 6-state region, Region 5, again, about I'd say over $100 million has been invested in new and existing community health centers just since that law was signed in October in March of 2010 across our 6-state region. And, of course, that's also taking place across the country. That builds on about $2 billion invested in health centers all across the country since over the last 3 years. Now, that discussion about community health centers being expanded helps lead me to our next speakers. And I'm really gratified to be able to spotlight an example of really effective collaboration across healthcare institutions, across organizations, across facilities. In this case, community health centers, academic medical center, hospitals, all working together to provide great primary care to those who need it most. So I'm honored to be able to highlight the Southside Health Collaborative, and I have the pleasure of introducing the leadership of the collaborative today. Now, established in 2005, the Southside Health Collaborative represents more than 30 community-based health centers and 5 local hospitals that are increasing access to care by building really strong and ongoing relationships between our Southside Chicago residents, our Chicago area residents, and community-based primary care doctors, and by focusing on those things that are most important, wellness, routine care, and prevention, so that we can work to prevent disease and detect illness before they turn into life-threatening emergencies. They're doing just tremendous work and having a great impact across our metropolitan region here. And I'd like to be able to have you hear their successes firsthand, so rather than steal their thunder, please join me as we welcome the Interim Director of the Southside Healthcare Collaborative, Ms. Kimberly Hobson, and Dr. Daniel Johnson, who's Director of Community Health Sciences at the Urban Health Initiative at the University of Chicago Medical Center.